Normal menstruation is a woman who has regular menses coming at intervals of between 21 and 35 days. The duration of the bleeding is anywhere between 2 to 7 days and is associated with very minimal or no pain at all. There are a few other abnormal bleeding you should be worried about. One is post-coital bleeding, that is bleeding after intercourse. In this case, we have to concern whether there's a presence of polyp or the presence of cancer of the cervix. The second abnormal bleeding is intermenstrual bleeding. That means bleeding in between the usual periods. This could be due to one, ovulation bleeding, in which a sudden drop in the estrogen level around the mid-cycle may cause a bit of slight bleeding. This sort of ovulation bleed is innocuous. It only lasts for a few hours to 2 to 3 days. Such things, if it occur on and off, it's not a concern. But if it's persistent and if it's very heavy in between the cycle, then one has to consider the possibility of cancer of the uterus. The last condition that one should be concerned about is bleeding after the menopause. That means the woman has already had the menopause, that means she has no period for a year, and then suddenly the menses come back, then cancer of the genital tract needs to be the number one concern. But of course, the other possibility is that the lady may have used some estrogen-containing compound through creams or even through herbal medication that can cause the bleeding. Heavy bleeding is said to be present if a woman needs to change pads every 1 to 2 hours, or she passes out large pieces of clots at the time of cycle. Most commonly is due to two reasons. One is uterine fibroids, and the second reason is common is uterine polyps. Uterine fibroids are actually benign, non-cancerous growth arising from the muscle wall of the uterus, and it's more common in women above 40. And if they are present, there's usually not always a reason to remove it. We will remove it under a few situations. One is when it's very large, that's more than 4 to 5 centimeters. Secondly, if the fibroid is growing rapidly, in which case then there's a possibility that there may be some malignant changes. Thirdly is when the menses is so heavy that she has anemia. The second more common reason for heavy menses is when there's polyps. Polyps are basically small little growth arising from the inner lining of the uterus. They can be seen at the mouth of the uterus, where they can be easily removed with a forceps, or they can also be found deep in the uterus, in which case an ultrasound scan needs to be done to confirm its presence, and after which then a minor procedure called hysteroscopy needs to be done to then remove it. The timing of the menses is under the control of female hormones, and this hormone needs to be produced at the correct amount, correct proportion at different times of the cycle. And this production of hormones are easily affected by things like stress, illnesses, changes in the weight, medication, and these are what we call a dysfunctional uterine bleeding. And they can be quite common in young ladies, especially when they are going through periods of stress. If the oral contraceptive pills are taken consistently on time and according to the instruction, then the cycles tend to be very regular. However, if they do not take it on time or they sometimes miss a few tablets, then the hormone control of the cycle becomes ineffective and they may get irregular cycles. The other reason why some women have irregular cycles is when they have growth in the lining of the womb. These growths are more common in older women in their 40s, in which case the possibility of cancer of the uterus needs to be considered. One is of course endometriosis, or what we call blood cysts, in which the inner lining of the womb, instead of being discharged through the birth canal, they flow backwards up the fallopian tube and enters the abdomen, after which then they slowly develop into blood cysts around the ovary. The other reason for painful period could be what we call pelvic inflammatory disease, or PID, in which germs travel up the birth canal, enter into the uterus, and then affect the fallopian tube and ovary. These often occur after intercourse, after childbirth, or if the woman had a recent miscarriage, or through the insertion of an intrauterine device. So when these women have PID, not only do they have painful period, but they get a lot of back pain, lower abdominal pain, fever, nausea, and even vomiting sometimes. Painful periods, most women get some cramps during the first or second day of the menses, or even prior to the menses. But if the pain is so bad they need to take strong analgesics, or they cannot function properly because of the pain, then there could be some other more serious reason for it. So in order to determine how irregular or how severe the bleeding is, we normally advise women to plot it down on a piece of chart, what we call a menstrual calendar, in which then we can determine how frequent the menses are, at what sort of pattern, and the amount of bleeding. So the amount of bleeding they will chart down as to whether it's a small dot or a bigger dot. So that will give us a clearer idea instead of just having the description from the lady. In case there's intermenstrual bleeding or there's post-menopausal bleeding, and we suspect there is possibly a cancer of the uterus, we will do a procedure called dilatation and curettage, or DNC. This procedure involves putting the patient under full anesthesia, and we will first put in a very small little telescope through the birth canal, through the cervix, and through that we can see the interior of the uterus. And if there's any growth that is present, we can then determine whether it's likely to be cancerous or is it likely to be benign. After which then the instrument is withdrawn and the second instrument goes in, and this instrument allows us to scrape out the entire lining of the uterus. And the purpose of that is to obtain the cells from the inside, so this can be analyzed under microscope. And through that we can determine if there's any cancer cells. So if there's a presence of cancer in the womb, in the lining, then we have to determine at what stage the cancer can be. And this is determined through a process called staging, in which MRI is done to determine whether there's any invasion of the cells into the muscle and whether it's spread beyond the uterus. Right? And depending on what stage the cancer is, then different surgery will be needed. Usually we have a place for them to lie down, quiet, dark area, and usually a bit of hot water bottle that may help them. Instead of just taking Panadol. A lot of women prefer not to take any analgesics in the belief that they might get addicted to taking painkillers over long term. For PID, then the usual treatment is through antibiotics. Surgery is not necessary unless collection of pus is found within the pelvis. When it is for surgery, there are two surgeries that we can consider. One is myomectomy, in which only the fibroid is removed, thus preserving the uterus, and therefore the lady continues to have regular periods. Or in more severe cases, where there are multiple fibroids or they are very large, then the entire uterus needs to be removed by a surgery called hysterectomy. When blood cysts are present, if the symptoms are very bad, then surgery may need to be done. And this involves laparoscopy, in which a small telescope is placed under full anesthesia through the belly button to confirm the diagnosis, and at the same time, the blood cysts can be removed through the laparoscope. As for the side effects, it depends on whether the ovaries are removed. If the ovaries are retained, then they are basically the same as before. But if the ovaries are removed, then they undergo what we call a surgical menopause, in which the female hormones are then suddenly reduced to a very low level, and they may get symptoms like hot flushes, insomnia, irritability, dryness of skin, and dryness of the vagina. Usually after the surgery is done, they are advised to have bed rest at home for about a month. In terms of their daily function, they can go back to it after about 4 weeks.